All right, big breaking news coming in. The Health Ministry sources have said that random sampling of passengers coming into Delhi has started from today. This is amidst the Covid scare in several countries in Asia, and variants, of course, coming in, which also are expected to impact huge sections of population in neighboring China as well. It is, in fact, random sampling and testing of foreign travelers at the Delhi airport that has now begun, which is to enhance the procedure of genome sequencing as well. In the past week, 4 cases of B7 variant have been found, and the government is closely watching the situation in China, is what is being stated. So this is the latest that's coming in as far as Covid scare is concerned, and the government taking precautions. Let's quickly take this across to Mayank. Mayank, last time we had seen that government had put in place elaborate protocol. This is perhaps the first step, the first of many. We at least hope that things do not get even more strict from here, because this is when we have just seen passenger traffic come back to normal levels, both in domestic as well as international terms. But in the midst of that, this fresh norm coming in, what are Health Ministry sources telling you? What exactly are they looking out for, and could these norms get more stringent in coming days? Mayank.
Well, absolutely, sir. The Health Ministry held a high-level review meeting chaired by the Union Health Minister Mansukh Mandavia, where they held, important discussion on what will be the step forward for the Indian government, considering the spurt of cases in China and United States. However, they backed down from the proposal given by the opposition MPs of banning the flights coming from China, where, it has the BF7 sub-variant of the Omicron variant of the coronavirus. It has created a havoc on and overwhelmed the Chinese healthcare system. So they have backed off from banning the flights from China. But what they are focusing on is, restricting the passengers coming from China and doing random sampling, so that if any patient will be found positive, their genome sequencing can be done. Because remember, yesterday a Union Health Secretary also written and an extensive letter to all the health department of the state asking for upgradation of genome sequencing, because only then there will be an early detection of the new variants. Because in the past as well, across the world, whichever country has struggled through the various waves of pandemic, they struggle because of the emergence of the new variants. And what we are learning from the peer-reviewed journals on BF7 subvariants of the Omicron variant, it is 4.5 times more resistance towards the vaccines that were given to the population across the country and also across the world. So BF7 subvariant is a very concerned variant as far as the Health Ministry is concerned, and that's why they are focusing on the genome sequencing that they can be contained. Because remember, we are also learning that as many as 4 cases have been reported of the BF7 sublineage of the Omicron variant, and that's why Health Ministry has come up with this idea that there will be random sampling of the passengers coming from China, so that they can find.
All right, so Mayank, this is very important to clarify for our viewers that these restrictions are largely for passengers coming in from China. Is it going to be random sampling, or are all passengers from China going to be tested when they come in here to India?
Well, as of now, the Health Ministry is focusing on random sampling. They are not doing it as a blanket, COVID test. It will be just a random sampling, because they are focusing that, only on the basis of random sampling, they are saying that the epidemiologist will be able to form a proper policy framework going ahead as far as the India's COVID management is concerned. And the government is saying that they are having a close eye on the developments as far as the COVID outbreak in China. But as of now, they are focusing only on random sampling, and not all the travelers coming from China will be tested. That's what we are learning from sources in the Health Ministry.
All right, this is very, very important, Mayank, because this is something that after several months we are seeing since Omicron last year, and in fact the wave that took place over the first 3 months of last year, and restrictions following that being lifted in about April, that once again we are seeing these kind of restrictions coming in. The larger question though, Mayank, is that in terms of actually dealing with it, in terms of infrastructure preparedness, there was a high-level meeting that took place in the Health Ministry over and above the testing that is taking place at the airport. What is being done here at the preparation in case of any exigency, or in case of the wave spreading here in India? What really is Health Ministry preparing to do? What are the arrangements that have been made?
Well, sir, the Health Ministry in this meeting that was conducted and chaired by Health Minister Mansukh Mandavia, they were discussing about why India is well prepared if there has to be another wave of the pandemic in the country. They are banking on two-pronged approach to combat COVID-19 pandemic. So first is immunization, because the task force of the COVID management, constituted by the government of India, they believe that India has been very widely covered by the vaccination through the multiple rounds of vaccination that has been done, and there have also been implementation of precautionary doses. So first point is that the COVID task force of the government believes that the wider immunization will keep the population safe against in case of a future outbreak. And also they are banking on the hybrid immunization, because India, mind you, did not implement the zero COVID strategy which was implemented by China. So the policymakers believe that the virus has spread through the various population cluster, and they have infected the population as well. So they have also the immunization cluster from the infection itself, and as well as immunization. So that gives the Indian people an edge over the Chinese people who were not exposed to the virus earlier. Talking about the preparation that the Health Ministry has done, they have asked all the health departments in the states to step up genome sequencing and send almost as many as samples of positively infected people with coronavirus.
Let's leave it there for the moment. Mayank, all eyes on what the Health Ministry will do and what kind of action it will take in coming days. We're moving